There are few Americans who are not hurt by the rising costs of health care. However, it's shocking to think that in today's America, over half of this country could be discriminated against in one of their most basic life needs. Women must shoulder the worst of the health care crisis, including outrageous discriminatory practices in care and coverage. According to the data compiled by the National Women's Law Center, under the current system, a 25-year-old woman pays up to 45% more for the same or identical coverage.
And there are a multitude of bad insurance company practices that are occurring today, stopping people from getting coverage because they have a pre-existing condition. And by the way, we found out that just last week that in the Washington Post that some insurance companies treat pregnancy or the intention to adopt as a reason to reject someone for a pre-existing condition. I mean, that's really pretty shocking to me. And in fact, in the same report, they said being pregnant or being an expectant father also, with some companies, were grounds for automatic rejection of being able to get a health insurance policy.
I wanted to take my last minute and just submit to the record a letter from Danielle Walker, a 25-year-old woman living in Baton Rouge, just graduated from school, went on to get a job. 20% of her modest paycheck, Mr. President, 20% is going towards insurance.
What is most shocking to me is that insurance companies can deny coverage to a woman for having been a victim of domestic violence. Domestic violence, something no woman plans for or wishes upon herself or anyone else, can be used to deny insurance coverage. Mr. President, this cannot be allowed to continue.
Rising cost of health insurance is hurting women, and it's hurting our country. For the millions of women across this country who open up the mail each month to see their premiums rising dramatically, who can't get preventive care like mammograms because the copays are too much, or who work part-time or for a small business that doesn't provide insurance for them and their families, who can't get covered for prenatal care, or who are forced to stay in an abusive relationship because if they leave, their sick kids will lose their health care coverage. Mr. President, we are their voice.
What you heard loud and clear today is that health care is a woman's issue, and health care reform is a must-do women's issue, and health insurance reform is a must-change women's issue. Because what we've demonstrated is when it comes to health insurance, we women pay more and get less. What we stand today on the Senate for is to say we want equal access and equal benefits for equal premiums.